Hi, I'm Jim Cunningham. I'm a mental health therapist and I specialize in treating trauma using a therapy known as EMDR. I'll explain what that is in just a minute. But first, I think it's important to talk about trauma to begin with, because a lot of us have this idea of trauma as these really big things that happen, can cause PTSD, and have lasting effects. Things like combat, sexual assault, abuse. And while those are traumatic events, what I find true for most people is that it's the little things that have the biggest impact. That look of disappointment that mom gave us when we were 5. That cutting offhanded remark that a coach or someone else we look up to made. It's these little traumas that tend to begin to define us at a young age, and they tend to be cumulative as we grow up. The result is that the most damaging and lasting effects of trauma are not the event themselves. It's the self-defeating negative things we begin to believe about ourselves and what we say to ourselves as a result. These become core beliefs, and they start to define us in a lot of different ways. Now, of course, these beliefs are irrational, but they're very real in the sense that they are at the heart of our anxiety, our depression, our failed relationships, our insecurities. These are the things that are under the surface all the time, that we carry around with us when we go out in our day, and they make everything a little bit harder. Now, the problem with trying to tackle this with talk therapy is that these beliefs are not a cognitive problem. They're a core problem. So rationally, we can say, well, these things shouldn't bother us, and yet we know that they do. They bother us in very personal and intrusive ways very frequently. I like to say it this way: the past lives in the present. And this is where EMDR comes in. It stands for eye movement desensitization and reprocessing. And it allows clients to tap into and resolve trauma at the root level. It's not hypnosis, but a method of using bilateral movements that sets the conditions for you to resolve the traumatic memories and the associated byproducts and symptoms of those memories, to include anxiety, depression, panic attacks, performance anxiety. In addition to trauma, though, EMDR has been very successful in treating phobias like addictions, physical and emotional abuse, disturbing memories, disturbing dreams, chronic pain, and as I said, even performance anxiety. The result that I find with many clients who undergo this therapy is they find they have more choices. They're more aware of themselves. They have more control over their feelings. Their reactions to their spouses and their kids change. They aren't as reactive. They have more control over their behavior. They feel less distressed. They sleep better. And as a result, their relationships improve. So ultimately, my goal as the therapist is to help you find some fresh perspectives, some practical insights, and some useful tools to make your life a little bit better. If you're interested in learning more, check out my website at jimcunninghamcounseling.com. Thanks and have an amazing day.